Brunner's Gland Hyperplasia is a cause of gastric outlet obstruction in a 7-year-old boy. Introduction: Brunner's glands are acinotubular glands which are located mostly in the mucosal or submucosal layers of proximal duodenum. Hyperplasia of this gland reported in almost 1 in 50 upper gastrointestinal endoscopies and account for approximately 5 to 10% of all benign duodenal tumors. Brunner's gland hyperplasia is usually asymptomatic. It can take form of polypoid or mass lesion and precipitate pyloric obstruction. It can cause gastrointestinal hemorrhage and intussusception in children. Due to its rarity in pediatric population, it tends to be misdiagnosed. Case description: we report a case of 7-year-old boy with Brunner's gland hyperplasia presented with recurrent vomiting. A 7-year-old boy was admitted to the hospital due to worsening of recurrent vomiting since 5 months prior to the admission. He also felt abdominal discomfort, bloating, and early satiety since he was 3 years old. The patient had been treated with several medications without any significant improvement. Epigastric pain was observed during abdominal palpation, and gastroscopy showed partial gastric outlet obstruction or pyloric obstruction, erosive gastritis, multiple ulcer, and erosive esophagitis. Histopathologic result from biopsy revealed chronic gastritis and positive for Helicobacter pylori. Abdominal CT scan showed protrusion of solid lesion intraluminal with diameter 1.18 to 1.25 cm in second part of duodenum. Patient then consulted to pediatric surgeon for laparotomy, exploration, and duodenostomy. Excision of Brunner's gland and biopsy were performed. Surgical reports show gastric dilatation with duodenal wall hypertrophy on the first and second part of duodenum. Histopathology from biopsy revealed Brunner's gland hyperplasia with lymphoid tissue. Post-surgery, patient recovered well and eventually discharged without any complaints. The prognosis was good. The conclusion: generally, Brunner's gland hypertrophy is benign and has a good prognosis. However, with the growth of benign proliferative lesion of Brunner's gland, mucosal ulcer may develop, thereby leading to the repair of gastric valvular metaplasia with papillary architecture and then malignant transformation. Thank you.